you. At this time, I will call the meeting to order of Assembly Health and Human Services today, this Monday, April 5th, 2021. At this time, Madam Secretary, will you please call the roll?
Assemblywoman Benitez Thompson.
Here.
Assemblywoman Black.
Here.
Assemblywoman Garlow.
Here.
Assemblyman Hafen.
Here.
Assemblywoman Krasner.
Here.
Assemblyman Matthews.
Here.
Assemblyman Orentlicker.
Here.
Assemblywoman Peters. Assemblywoman Summers Armstrong.
Here.
Assemblywoman Thomas.
Here.
Assemblywoman Titus.
Here.
Chair Wynne.
Here. And if we can please mark Assemblywoman Peters present when she arrives. I know she's currently presenting in another hearing in another committee right now. Today we have a work session and 2 bill hearings. I'm going to start off with the work session first. Let's begin with Assembly Bill 205. Mr. Ashton, can you please present the bill with the amendments? And we'll start there.
Thank you very much, Chairwoman. For the record, Patrick Ashton, Committee Policy Analyst of the Legislative Council Bureau. Just a reminder, as nonpartisan staff, I can neither advocate nor oppose any measures that you will consider today. We heard Assembly Bill 205 on March 31st. This bill authorizes certain healthcare professionals to issue an order for opioid antagonists to a public or private school for the treatment of an opioid-related drug overdose that may be experienced by a person at the school. This bill also authorizes a school nurse or other designated employee of a school who is properly trained to administer an opioid antagonist to any person on the premises of the school who is reasonably believed to be experiencing an opioid-related drug overdose. The bill also establishes certain other requirements as outlined in the bullet points on the work session document. And finally, this bill provides that a healthcare professional is not subject to disciplinary action for issuing an order for opioid antagonists to a school and exempts certain entities from liability for certain damages. Assemblywoman Cohen proposes to amend the bill to limit the exemptions prescribed in sections 5 and 8 of the bill to only exempt from liability a school, school district, employee of a school, and certain other persons affiliated with a school for any error or omission concerning the acquisition, possession, provision, or administration of epinephrine or an opioid antagonist if, first, the administration occurs during an emergency, and second, the error or omission is not a result of gross negligence or reckless, willful, or wanton conduct. See also attached the AB 205 mock-up, and Chair Wynne, this is my summary.
Thank you. Do we have any members of the committee? Are there any questions? I believe I see Assemblywoman Cohen, who had presented the bill, on the call. So if there are any questions at this time, questions? I see Assemblyman Hafen. Go ahead.
Madam Chair, if there are no other questions, I'd make a motion to amend and do pass.
I saw a hand up with Assemblywoman Titus, and I don't know if that was a second or if that was—
That's a second, Madam Chair. Since it's my bill from last session, why wouldn't I second it or put it in there first?
I just wanted to make sure it wasn't a question. Do we have any other questions? Seeing none, I will take that motion from a motion to amend and do pass from Assemblyman Hafen and that second from Assemblywoman Titus. Madam Secretary, can we do a roll call vote?
Assemblywoman Benitez Thompson.
Yes.
Assemblywoman Black.
Yes.
Assemblywoman Garlow.
Yes.
Assemblyman Hafen.
Yes.
Assemblywoman Krasner.
Yes.
Assemblyman Orentlicker.
Yes.
Assemblywoman Peters. Assemblywoman Summers Armstrong.
Yes.
Assemblywoman Thomas.
Yes.
Assemblywoman Titus.
Yes.
Chair Wynne.
Yes. Seeing the motion passes.
Excuse me, this is Assemblyman Matthews. I believe I was skipped in the roll call vote.
I'm sorry. Assemblyman Matthews.
That's okay. I'm a yes also. Just wanted to make sure that was made official.
Thank you.
Thank you. Shows
Sorry
I'm
about
paying
that, Assemblyman Matthews.
At least you know I'm paying attention, right?
Well, the motion passes with all members
you.
present. And I will assign this floor statement to Assemblyman Matthews.
Thank you very much.
Chair, your microphone is muted.
Details. Sorry about that. Next, we will go to Assembly Bill 343. I will note that there were some substantial amendments. Mr. Ashton, can you please go over those amendments as well as the bill?
Thank you so much, Chairwoman. For the record, Patrick Ashton, Committee Policy Analyst. We heard AB 343 on March 29th. And for the sake of time, I will go straight to the summary of the amendments. Assemblywoman Thomas proposes the following amendments to the bill, and see also the attached conceptual amendment. Delete subsection 1 of section 1, and instead, Amendment 1 requires certain local government entities within the urbanized area of each Clark and Washoe County to collaborate during the legislative interim and develop a proposed plan for each county for conducting walking audits within urbanized areas of the respective county. The proposed plans shall consider the items A to J as outlined on the bill page. Amendment 2 require the Nevada Department of Transportation to participate in the development of these proposed plans to the extent feasible and appropriate based on NDOT's jurisdiction. Amendment 3 require the Southern Nevada Health District for Clark County and the Washoe County Health District for Washoe County to assist in the development of the respective proposals and to publish the results of any walking audit conducted on their respective internet websites. Amendment 4 require both Clark and Washoe County to report their respective plans outlining their proposals for implementation of walking audits to the Legislative Committee on Healthcare no later than June 1st, 2022. Other amendments. Amendment 5 revised subsection 2 of section 1 to retain the parameters related to walking audits as optional parameters in their respective proposed plans to the extent possible. Amendment 6 deletes section 2, thereby removing the unfunded mandate provision in the bill. Amendment 7 make this bill effective upon passage and approval. And finally, I wanted to state on the record, the stakeholders of this bill will work with the legal division to clarify the requirements regarding the reporting and publication of any walking audits as outlined in the conceptual amendment. Madam Chair.
Thank you for that clarification, Mr. Ashton. I know, I believe Assemblywoman Thomas is here to answer any questions. I know that she did reach out to many of the stakeholders that had concerns during the hearing, and I believe that her conceptual amendment takes those into consideration. But are there any members of the committee that have any questions based on that amendment? Seeing none at this time, I have one here. Assemblyman Hagan, go ahead.
Madam Chair, I apologize if this is the wrong time. It's just a statement for the record. Would this be the appropriate time?
Yes, go ahead.
Okay. I just wanted to thank the Assemblywoman for working with the stakeholders. I will be voting no today on this, but would like to reserve my right after seeing the actual amended language, because I do know a lot of work has gone into this, and after seeing the language, I may want to change my vote. I just wanted to get that on the record. Thank you, Madam Chair.
Thank you. And with that, seeing no other questions regarding this bill, do I have a motion to amend and do pass Assembly Bill 343?
So moved.
Chair, when you're on mute.
Man, I'm having a hard time this morning with the mute button. I see a motion to amend and do pass from Assemblywoman Danita Thompson and a second from Assemblywoman Gorlow. Just me talking to myself here. That makes it even better. And with that, we will take a roll call vote.
Assemblywoman.
I'm sorry, any questions? One second, I'm sorry, out of order. Any questions or comments regarding the bill? Okay, seeing none, sorry about that, Madam Secretary. Go ahead now.
Assemblywoman Benitez Thompson.
Yes.
Assemblywoman Black.
No.
Assemblywoman Gorlow.
Yes.
Assemblyman Hafen.
No.
Assemblywoman Krasner.
Yes.
Assemblyman Matthews.
No.
Assemblyman Orentlicker.
Yes.
Assemblywoman Peters. Assemblywoman Summers Armstrong.
Yes.
Assemblywoman Thomas.
Yes.
Assemblywoman Titus.
No.
Chair Wynne.
Yes, having a majority, the motion passes, and I'll assign that floor statement to Assemblywoman Thomas. And if we can go to our next bill on work session, which is Assembly Bill 344, and I will turn this over to Mr. Ashton to go over that text and any amendments.
Thank you, Madam Chair. For the record, Patrick Ashton, Committee Policy Analyst. We heard AB 344 on March 29th as well. The bill authorizes ADST to establish a program to facilitate the transition of older persons and vulnerable persons from hospital to their places of residence. Assemblywoman Thomas proposes the following amendments, and see also attached to the work session document a conceptual amendment to this bill. Amendment 1, change vulnerable person to person with a disability throughout the bill, thereby authorizing the division to establish a program to facilitate the transition of older persons and persons with disabilities rather than older persons and vulnerable persons. Amendment 2, for purposes of the provisions of this bill, define person with a disability to have the meaning ascribed to it in Section 1 of AB 35. Amendment 3, clarify in subsection 2C of Section 1 that the division may fund the program by billing third parties for the services provided by the program for current plan members only. And Amendment 4, for item 4 of the conceptual amendment, Assemblywoman Thomas wants to correct this amendment and have Assemblywoman Lisa Krasner instead of Assemblywoman Heidi Kasama to be added as a co-sponsor to the bill. Madam Chair.
Thank you. At this time, do the members have any questions?
I have well, we can wait till the vote. I can do it before we vote on it.
Okay, perfect. Do I have any questions about the bill at this time?
Madam Chairwoman?
Go ahead, Assemblywoman Benitez Thompson.
Perfect. Thank you so much. And I appreciate the amendment and the work from the bill sponsor. I just wanted to see from my reading, I don't think I read anything in here that would absolve the hospital from its normal due diligence for providing for a safe discharge. I just want to make sure that we're not shifting burden, that an ancillary program by the county would be wonderful, absolutely need it, but that until that point, or even if that becomes effective, that there's nothing where I don't see touching the hospital's obligation for safe discharge.
That is a true statement, Assemblywoman Majority Leader.
Thank you. Do we have any other questions regarding this? At this time, I will seek a motion to amend and do pass.
So moved.
Do I have a second? I see a motion from Assemblywoman Benitez Thompson, a second from Assemblywoman Summers Armstrong. And I will take any comments on the motion at this time. Assemblywoman Titus?
Thank you, Madam Chair. Unfortunately, although the concept is well-meaning, I cannot support this bill as written, even with the amendments, and it really plays along the same question that Majority Leader asked, because right now with discharge, we have to have a safe discharge. This bill may actually create some problems when enacted and delay some of those discharge because we're not able to do some of the things the bill is asking us to do. I think that the hospital's already obligated to do this. There already are programs involved in certain places that can handle such a program. There's nothing that limits them from starting. And so unfortunately, I have to be a no on this bill. Thank you.
Do we have other comments on the bill at this time? Madam Secretary, can we take a roll call vote at this time?
Assemblywoman Benitez Thompson,
Yes.
Assemblywoman Black,
No?
Assemblywoman Gorlow,
Yes.
Assemblyman Hafen,
No.
Assemblywoman Krasner,
Yes.
Assemblyman Matthews,
No.
Assemblyman Orentlicker,
Yes.
Assemblywoman Peters, Assemblywoman Summers Armstrong,
Yes.
Assemblywoman Thomas,
Yes.
Assemblywoman Titus,
No.
Chair Wynn.
Yes. Having a majority, the motion passes, and I will assign that floor statement to Assemblywoman Thomas.
Thank you.
At this time, we are moving to our next bill on work session, Assembly Bill 426. And Mr. Ashton, can you go ahead and present that bill as well?
Thank you, Madam Chair. For the record, Patrick Ashton, Committee Policy Analyst. Assembly Bill 426, which we heard on March 31st, authorizes an agency that provides child welfare services or its designee to request that the court issue a warrant to place a child in protective custody if there's reasonable cause to believe that the child needs protection from injury, abuse, or neglect, but the threat is not imminent in the time it would take to obtain a warrant. The bill also sets forth certain requirements for such a warrant and provides for certain other provisions. There were no amendments. Chair Wynn?
Thank you. At this time, I will see if there are any questions for members of the committee regarding this. And I will note that there was a pretty substantial explanation document that was on Nellis and provided as a part of the work session document that this working group of 45 attorneys, judges, court administrators, public defenders, and DAs all managed to agree on, which I still just am mind boggled by that. But do we have any other questions regarding the bill at this time?
Madam Chairwoman, I just have a comment if you'd be willing, or do you want me to wait till the motion?
You can go ahead and do it now. It's fine.
Oh, thank you. I just want to say I appreciate so much the uploading, the walkthrough, and kind of the more intent and explanation on these bills. It was a large working group and so many people working on it. I just wanted to make sure that thought and intent was captured and living somewhere in a public space, because we know that when we refer back to legislative record, the groups of people that change, they don't remain static. And so there's something for future legislators, future parents caught up in the system, future people who are part of the system to refer back to. And I know some of this was coming from, I think, case law as well. And so we're just codifying pieces of it. But I appreciate the fact that we've got that in for the work session.
I agree, Assemblywoman Benitez Thompson. I appreciate the work that they put in to put that into a working document that will become a part of the legislative history. With that, are there any other questions regarding this bill? Seeing none, can I take a motion to, I believe it's just do pass. I see a motion from Assemblywoman Gorlow and a second from Assemblywoman Titus. With that, do we have any comments on the motion at this time? Seeing none, Madam Secretary, can you please do a roll call vote?
Assemblywoman Benitez Thompson,
Yes.
Assemblywoman Black,
Yes.
Assemblywoman Gorlow,
Yes.
Assemblyman Hafen,
Yes.
Assemblywoman Krasner,
Yes.
Assemblyman Matthews,
Yes.
Assemblyman Orentlicker,
Yes.
Assemblywoman Peters, Assemblywoman Summers Armstrong,
Yes.
Assemblywoman Thomas,
Yes.
Assemblywoman Titus,
Yes.
Chair Wynne.
Yes. Having passed unanimously with all members present, the motion passes. And at this time, I will assign that floor statement to Assemblywoman Krasner. Next, if we can go to Assembly Bill 430, also on the work session document. Mr. Ashton, go ahead.
Thank you, Chair Wynne. For the record, Patrick Ashton, Committee Policy Analyst. We heard Assembly Bill 430 on April 2nd, and it revises or removes certain obsolete terms used to describe the provision of certain services to persons with intellectual disabilities and persons with developmental disabilities in Chapter 435 of Nevada Revised Statutes. There were no amendments, Madam Chair.
Thank you. At this time, are there any questions regarding Assembly Bill 430?
When ready, I'll move to approve, Madam Chair.
Okay, seeing no questions. Is that a question or a second, Assemblywoman Summers Armstrong? A second. Okay. So with that, I will take the motion from Assemblywoman Titus, the second from Assemblywoman Summers Armstrong. Any comments on the bill? Seeing none, Madam Secretary, can we please do a roll call vote?
Assemblywoman Benitez Thompson,
Yes.
Assemblywoman Black,
Yes.
Assemblywoman Gorlow,
Yes.
Assemblyman Hafen,
Yes.
Assemblywoman Krasner,
Yes.
Assemblyman Matthews,
Yes.
Assemblyman Orentlicker,
Yes.
Assemblywoman Peters, Assemblywoman Summers Armstrong,
Yes.
Assemblywoman Thomas,
Yes.
Assemblywoman Titus,
Yes.
Chair Wynne.
Yes. I'm sorry. I don't know if I was the only one. I didn't hear Assemblywoman Black. Was she a yes?
Yes.
I believe she was. Okay, sorry. With that, it is a unanimous pass with all members present, and the motion passes. And I will assign that floor statement to Assemblywoman Brown May. And if she is unable to, I will assign a backup to Assemblywoman Black. And with that, that concludes our work session document for today, and we will move into our bill hearings. At this time, I am going to take these slightly out of order. And hold on one second. I'm going to start, actually they are in order as they are on the agenda. We are going to start with the hearing on Assembly Bill 348. I will now open the hearing on Assembly Bill 348. This bill revises provisions related to the Patient Protection Commission. And I would welcome Assemblywoman Carlton to begin when you are ready.
Thank you very much, Madam Chair. I hope you can hear me. So
with
that, thank you very much. For your record, I am Maggie Carlton, representing Assembly District 14. Thank you for the opportunity to present Assembly Bill 348 before you today. First, I'd like to thank your wonderful staff that helped me with this bill. This was one of those bills where you give all the descriptions and walk people through it, and you receive the bill. You wonder where the miscommunication might have happened. And they were very, very helpful in helping me get through the bill and actually get back to the place where I wanted to be. So I just wanted to give them my thanks for all their work. As we move forward, I'd like to draw your attention to the conceptual amendment that is on Nellis. As I said, this didn't quite come out the way we planned it. So I'll be working from the conceptual amendment. And if it's all right with you, Madam Chair, I'm just going to give a little background and then walk through section by section and then try to answer any questions that the committee may have. So during the 2019 legislative session, Governor Sisolak proposed that the legislature pass Senate Bill 544. It's one of our large budget bills. And in that bill, in his budget, it created the Patient Protection Commission, an independent body tasked with reviewing issues related to Nevadans' healthcare needs, as well as healthcare accessibility, affordability, and quality. However, as we all know, and I've learned over the years in this body, that legislation can be iterative. It's going to be constantly evolving. And after the commission got up and running, we recognized the need to make some adjustments to it. I'd like to thank Dr. Khan. He did an excellent job leading the commission, and the executive director, Sarah Cooligan, especially through a pandemic year. They were just getting up and going, and then the pandemic happened. So I'd like to thank them for all their hard work that they did on the commission and the deliverables that have come out of the commission. The goals of AB 348 are to move the Patient Protection Commission from the Office of the Governor to the Department of Health and Human Services, revise the commission membership, ensure members are held accountable, address issues related to conflict of interest, and give the commission tools to operate more effectively. If you turn to the bill and the proposed amendment, I'd like to walk you through them. So, first issue is the removal of the advisory committee. First, it was never my intent to create a patient protection advisory committee. So the first item in the conceptual amendment proposes to delete section 1. Item 3 of the amendment also restores the commission's existing duties, which were deleted as introduced. The move to DHHS and the membership. The amendment does not change section 2 of the bill, which moves the commission under the Office of the Director of the Department of Health and Human Services. It revises the commission membership and increases the number of voting members from 11 to 12. Specifically, section 2 revises the membership as is listed in the bill to the registered nurse who practices primarily at a nonprofit hospital, a physician or registered nurse who practices primarily at a federally qualified health center, a pharmacist at a pharmacy not affiliated with a chain of pharmacies, or a person who has expertise and experience in advocating on behalf of patients, a nonprofit public hospital located in the county that spends the largest amount of money on hospital care for indigent individuals. I practiced that and I still stumbled over it. A representative of a private nonprofit health insurer with the highest percentage of insured people who are adversely affected by social determinants of health, a person who has expertise and experience advocating for the uninsured, a person who has expertise and experience advocating for people with special health care needs, and a DHHS employee with expertise in health information technology and patient access to medical records. There's one small change that I would like to propose in this particular section. It was brought to my attention that there may not always be an employee available, that it might be best to get a consultant depending upon how HIT actually works. So I would like to add in the option of having that be an employee or a consultant, depending upon who the would be the best fit for health information technology. We know sometimes we don't have the employees that are available to do this. So being able to get a consultant, I think, would be a good option just in case. The section also adds the executive officer of the Public Employees Benefits Program as an ex officio member. Section 23 staggers the terms of the new members to ensure that not all term out at the same time. We understand how important the historical perspective and continuity in the commission needs to be so that it can move forward. So this is our standard way when we do change membership of commissions to be able to allow people through attrition to move out and the new positions to move in. In dealing with conflicts of interest, Section 2 provides that members of the Commission must comply with the requirements of NRS 281A 420 regarding disclosure of conflicts of interest and abstention on voting because of conflicts. Item 5 is the accountability issue, and the conceptual amendment requires that the Commission to adopt bylaws to provide an operational framework of duties. In addition, the amendment provides that the members serve at the pleasure of the governor, and this change will allow the governor to remove any member that would need to be at will. The all-payer claims database was never intended to be in this bill. By removing the all-payer claims database, it does remove the 2/3 notation on the bill, so it will no longer have that notation on the front. Sections 3B, sections 5 to 21, and sections 25 and 26 all deal with the establishment of the all payer claims database. It was never our intent to have this in the bill. Actually, Senate Bill 40 is the commission's own bill, and it is dealing with this issue. So I believe that might have been the confusion there. So for those reasons, we're taking the all payer claims database out of this bill. Section 3A and C require the commission to also establish a plan to increase patients' access to their medical records and provide for the interoperability of medical records between providers of healthcare in accordance with HIPAA and other confidentiality laws and regulations. And it also makes certain recommendations to the director and legislature concerning the analysis, availability, and the use of healthcare data. In establishing subcommittee or working groups, item number 4 of the conceptual amendment authorizes the commission to establish any committees or working groups as necessary with the intent of providing a tool to take a deeper dive into certain policy areas. There have been some questions whether this is necessary. Does the commission already have this authority? Or do we need to give this to the commission? I would leave that to your excellent staff to make sure that this is addressed. If it's not clear in the original language that established the commission, we'd like to make sure that it is clear. So if they do establish these working groups, that they have the authority to do the work that they need to do. And finally, Section 24 of 348 designates the commission as the state entity for the Peterson-Milbank Program for Sustainable Healthcare Cost. This program advances state-based efforts to make healthcare more affordable for residents, employers, and the state. In closing, Madam Chair, I've been working on healthcare issues for a very, very long time. I came to it from the perspective of having really good healthcare and having to explain to my coworkers how healthcare actually works and how they should access their healthcare, and that it is a really great benefit to be able to have. In this building for a lot of years, we've debated a lot of bills on healthcare, and we've done them with a lot of anecdote. We need to have the data. The Patient Protection Commission and the data components that are involved in this bill, I believe, will give this legislature and future legislators the opportunity to be able to analyze the real data and what's really happening in healthcare in our state, and how do we address the issues that we need to make sure that we have good quality, affordable, safe healthcare for the citizens in this state. Again, I'd like to thank Dr. Khan and Ms. Cooligan for all the work that they've done. The governor's staff, I have met with them and we've gone over a number of components in this bill. This is not to say that the commission did not do a good job. I believe they did an excellent job for what was in front of them, but I also believe there were some missing pieces in the original bill, and we all know that these commissions are constantly evolving. So I hope that AB 348 gives the commission the tools that they need to continue the work that they are doing. And I'd be happy to stand for any questions.
Thank you, Assemblywoman Carlton. I have a question, and I think we have a couple others. I'm going to give people a little bit of an opportunity to send me a message if you have some questions. In looking at this, do you think this bill will get, and this with the amendments, will give this commission some more flexibility? As you had talked about how it's a dynamic process, like, are we going to be here in 2 more years kind of expanding the ability and the responsibilities of this commission, or do you think this allows for some of that flexibility?
I believe, thank you, Madam Chair, very much for the question. I believe with the changes in the membership of this commission and a lot of the other things that are going on in the state, as far as being able to collect more data about healthcare, I believe this gives this commission the opportunity to dig in and do some really great work and move forward. And I know that if there are other issues in the future, there's always an opportunity to reach out to the administration and or to the legislature to have a conversation about any other needs that they might have.
I have a question next from Assemblywoman Titus.
Thank you, Madam Chair. And Assemblywoman Carlton, I appreciate all the hard work you truly have done into looking into the cost of healthcare in Nevada. And I know that you've reached out to many agencies. And I was going to start off with a question regarding the all-payer claims database, but I'm looking at your amendment. So I absolutely appreciate that you removed that section and having that pulled up. But I want to go back to a section, not 1, because you removed that one, but under section 2, when you list and you're redefining some of the membership on that, and under section, it wouldn't be section 2 anymore, it'd be section 1, but the bill that I'm looking at, it's section 2, down to it's A and the number 2, which says you're changing it from 2 representative providers to 1 member who is a provider of healthcare. And so, what's the definition of that you're using, provider of healthcare, just so I can have some clarity whether you're going to speak about and what's that definition? So could it be a podiatrist, a masseuse, a social worker? What defines provider of healthcare?
And Madam Chair, through you to Assemblywoman Titus, section 2 with the membership section, list a physician or registered nurse who practices primarily at a federally qualified health center. So I'm not sure if we're asking about that or if we're referring to a registered nurse who practices at a primarily at a nonprofit hospital. We're actually taking provider of healthcare and putting a little more parameters into it and trying to get to providers that work in the nonprofit world or the FQHC world. The folks that deal a lot with indigent care. So if you look under section 2, it has a listing of the different folks that we would like to see as the categories as members on the commission, and then within that category, that person would fit in there. So let's say if it's the nonprofit public hospital located in the county that spends the largest amount of money on hospital care for indigent persons, I believe that's very clearly UMC. So there is a representative from UMC now on the commission. That person's term, I believe, is up on July 1st of this year. If they wanted to be reappointed and resubmit their name again or their designee, then I believe they would fit into this category moving forward. So we would have attrition from one set of members to the next, and that way that person would still have an opportunity to participate on this commission and provide their expertise when it comes to hospital care for indigent individuals.
Yeah, certainly. I appreciate that explanation, but it still doesn't appear clear under section 2, 1 and 2, because then that picks up on the next page, 1 member who is a registered nurse who practices primarily at a hospital. You still haven't defined the first one because you've defined the nurse, but 1 member who is a provider of health care.
And Madam Chair, I apologize. I'm not tracking with Dr. Titus. I'm working from the Conceptual Amendment.
Yeah,
so
at the bill itself, and you didn't change that section.
Right. So I'm just trying to understand exactly what the question is.
Right. So
again, if you look at the Conceptual Amendment, it lists all the folks. So I'm trying to track with that.
All right, I appreciate that. I'm looking at your amendment also, and it doesn't have any.
So on page, so if you're looking at the actual bill, Madam Chair.
Yeah, 1 second. If we could just talk one at a time. I know my secretary is trying to keep up with who's speaking. So go ahead, Assemblywoman Carlton.
Thank you, Madam Chair. So I'll go to the bill then and set the conceptual aside for a moment. So if I go to the actual bill, section 2, page 4, line 4, 1 member who is a registered nurse who practices. So if Dr. Titus would like to point out between lines 4 and 27, what the question is.
Again, and I apologize. This is Assemblywoman Titus. I'm looking at the actual bill, and I just needed some clarity on the true membership of this. I just want to make sure that my point of the question, so we can get to that, is I want to make sure that there were members that on this commission that were perhaps private, had their own small business in healthcare, were not associated with it. Maybe they are for profit. Maybe they are out there, not in the world, this big, huge world, but they do administer healthcare. And we still have some folks in healthcare that do this privately, that are maybe a small physical therapist who is a provider of healthcare, and they have their own practice as a physical therapist. And so that's what I'm getting at. I'm looking at the small provider of healthcare not associated with a huge nonprofit, a huge hospital, et cetera, that are still have a lot to do in offering healthcare, making sure they're represented from a different viewpoint. And I'm just wondering, would they fill in that slot there? So that's my purpose of the question. Somebody in industry privately that has a business in healthcare.
Okay, and I believe I can answer that by saying that we did not actually change that. And the way the appointments happen, anyone could put their name in for that. I believe the PPC already has a definition for that, and I believe the nurse is already dealt with. We have a registered nurse. We also have anyone who has experience advocating for people for the uninsured. So I'm not sure about getting that specific.
Assemblywoman Carlton, I also see Sarah, I'm going to butcher her last name, Colligan, on the line. I don't know if she is here to present testimony or to answer any questions, but we might be able to go to her or Ms. O'Krent with LCD Legal to clarify the existing membership of the PPC, if that would be helpful.
And if Ms. Cooligan would like to, I'll be more than happy to phone a friend, Madam Chair. And I appreciate the offer. I'm just my original confusion was just trying to figure out exactly what the question is. I don't believe there's any significant change to the definition of provider of healthcare. I believe we're just trying to aim at folks with different experience levels. But if Ms. Cooligan has anything to add, I would be more than happy for her to step up and answer the question. Thank you.
Thank you. If you could state your name for the record before you speak, Ms. Cooligan.
Thank you.
No problem. Thank you so much, Chair Nguyen, members of the committee. My name is Sarah Sholhagian, for the record. I serve as the Executive Director for Nevada's Patient Protection Commission. I was trying to follow along with the question myself, but if I could offer some insight into the current makeup of the PPC, I'm happy to add that into the conversation. So NRS 439-908 currently provides for the commission's membership outline, and what it looks like now is you have 2 providers of healthcare, 1 academic or person in public health, 2 hospital representatives, 2 health insurers, 1 prescription drug representative, 1 member of the general public, and 2 patient representatives. That's the current makeup of the commission.
All right. Madam Chair, follow up.
Yes, go ahead with your follow-up.
Thank you. And still thank you. I'm still have concerns, and I'll just go on record of recognizing that perhaps that small business person in healthcare isn't represented, that maybe it's for profit. I also want a clarification, Assemblywoman Carlton, when you presented the bill, you said that taking out that the sections 5 through 21, I believe, has now the all-payer claims database has removed the 2/3. So you brought that up, and I know we're not a money committee, but did it remove the $7 million fiscal note?
Oh yeah, definitely. That fiscal note, I believe, was tied to the all-payer claims database. Yes.
Thank you very much. I just wanted that for clarification. Thank you, Madam Chair, for the questions.
Thank you. Do we have any other questions from committee members? I'm looking around. Seeing none, I will begin testimony in support. Assemblywoman Carlton, do you have anyone on the Zoom that will be testifying in support?
No, Madam Chair, I did not line up anyone in particular. I tried to be very cognizant of the fact that I didn't want to put the current commissioners in an awkward position because of some of the changes that we were making in working with the administration. Since this was originally the governor's bill, I didn't want to put anyone in as I said, in an awkward position. So I have had numerous conversations with folks about the bill and definitely explaining that there was a big conceptual amendment coming to address especially the all-payer claims database. So I'm not sure if there is anyone out there in support. I did get a number of calls of folks that were in neutral. So thank you very much, Madam Chair.
No, I just wanted to make sure there wasn't anyone specifically on this Zoom call. But with that, broadcast services, if we begin testimony in support of Assembly Bill 348. Again, I'd remind callers to please clearly state and spell your name and limit your testimony to 2 minutes. Again, staff will be timing each speaker to ensure we are given a fair opportunity to speak on the topic. And at this time, we will begin testimony in support of Assembly Bill 348.
Testify in support of Assembly Bill 348. Please press star 9 now to take your place in the queue. With a caller with the last 3 digits, 484, please slowly state and spell your name for the record. You have 2 minutes and may begin. Caller with the last 3 digits, 484, please press star 6 to unmute.
Good afternoon, Assemblywoman Carlton and Chairwoman and committee members. I want to thank you for considering this bill and for Assemblywoman Carlton bringing it forward. For the record, my name is Maya Holmes on behalf of the Culinary Health Fund. That's MAYAHOLMES. Governor Sisolak's 2019 decision and the legislature's support to create the Patient Protection Commission was truly an essential step to improve our healthcare system for all Nevadans. Healthcare costs are just rising at a staggering rate and are increasingly unsustainable for already strained patient, employer, and public and private payer budgets. The PPC's primary goal is examining and proposing solutions to address access, quality, and affordability in our healthcare system. All of these issues are shaped by healthcare costs. We support AB 348 and Assemblywoman Carlton's amended proposal to ensure a diversity of critical stakeholders in our healthcare system are represented on the Commission. They will bring specific and much needed expertise that is so crucial to this Commission's work. We also support the effort to address any conflicts of interest, adopt needed bylaws, and place the PPC within DHHS, which will provide it with additional tools and structure to achieve its goals. We also support Governor Sisolak's decision for Nevada to join the multi-state Peterson-Milbank Program for Sustainable Healthcare Costs to advance state efforts to address healthcare cost growth. The governor wants public policy solutions to increase access to affordable quality healthcare in Nevada. He's also deeply concerned and committed to addressing the issue that over 50% of Nevada's BIPOC population is at risk of poor health outcomes. Governor Sisolak asked the PPC to assist its executive director in this work and for recommendations to develop a statewide healthcare cost growth benchmark, which other states are doing, analyze cost growth, and evaluate cost drivers. AB 348 and Assemblywoman Carlton's proposed amendment will ensure that the PPC has the breadth of expertise, structure, and tools at its disposal to address these critical issues. Thank you.
Thank you. And right at 2 minutes. Thank you, Ms. Holmes. If we can go to our next caller in support.
If you have recently joined the call and would like to testify in support of Assembly Bill 348, please press star 9 now to take your place in the queue. With the caller with the last 3 digits, 120, please slowly state and spell your name for the record. You have 2 minutes and may begin. Caller with the last 3 digits, 120, please press star 6 to unmute.
Hi, my name is Stacy Sasso, Executive Director for the Health Services Coalition, representing 25 employer and union-sponsored health plans in Southern Nevada. While cost was a key pillar of the PPC, the coalition is disappointed that one of its 2 bills is focused on increasing telehealth reimbursement to doctors with no indication this would increase access. We are in support of AB 348 today. When the governor formed the PPC, it was with the intention of protecting the patient, with price focus being one of those topics. The proposed nonprofit focus of this proposed changes supports the need for the patients to put the patients first in the commission. The HSC is thankful to the PPC for the work they have done thus far and are looking forward to continuing to watch and participate in the future. Thank you.
Thank you. If we can go to our next caller in support of Assembly Bill 348.
Chair, we have no more callers in support at this time.
Thank you. At this time, if we can go to any callers in opposition of the bill, Assembly Bill 348.
To testify in opposition to Assembly Bill 348, please press star 9 now to take your place in the queue. With the caller with the last 3 digits, 263, please slowly state and spell your name for the record. You have 2 minutes and may begin.
Good afternoon, Chair Wynn and members of the Assembly Health and Human Services Committee. My name is Jesse Wadhams. That's JESSEWADHAMS, representing the Nevada Hospital Association. We've spoken with Assemblymember Carlton, and she walked us through both her rationale for the bill itself and then, more importantly, the conceptual amendment. The NHA was very supportive of the creation of the Patient Protection Commission in 2019, and we agree with Assemblymember Carlton's conceptual amendment. Our opposition today is really focused on the change of representation in Section 2 of the bill itself. We believe these changes could actually be additive to the current makeup and the breadth and of the commission members, and continuing to add important voices to the conversation. So we appreciate the opportunity to work with Assemblymember Carlton going forward on this language, and look forward to the future processing of the bill. Thanks.
Thank you. Do we have any other callers in opposition to Assembly Bill 348?
There are no other callers in opposition at this time.
Do we have any callers in neutral of Assembly Bill 348?
To testify in neutral to Assembly Bill 348, please press star 9 now to take your place in the queue. Caller with the last 3 digits, 523, please slowly state and spell your name for the record. You have 2 minutes and may begin.
Thank you, Madam Chair, members of the committee. My name is Tom Clark. That's TOM. CLARK. I'm here today on behalf of the Nevada Association of Health Plans, and really want to thank Chair Carlton for bringing forward this bill and just recognizing the important hard work that the PPC did in the interim. And from what we can tell on the legislation that's being proposed across the board, the work that they have in the future. Our concern is with under Section 2. We appreciate the bill recognizing and having the intent of health insurance representation. But as drafted, the bill changes the health insurance representation from 2 folks to 1 and defines that 1 representative. And this is in Section 2, Sub 6, line 12.
I'm sorry to interrupt you, Mr. Clark. We're in testimony in neutral. This sounds like it's opposition testimony. So I'm going to let you continue your testimony regarding the bill as amended, but I'm going to reclassify it. So go ahead.
Thank you, Madam Chair. It's under Section 2, Sub 6 of the legislation that defines the representative from a private nonprofit health insurer with the highest percentage of insured in the state who are adversely impacted by social determinants of health. We respectfully request that we retain the 2 health insurance representatives, and at least one of those private insurers be regulated by the Nevada Division of Insurance under Title 57. I apologize for any confusion, Madam Chair. Thank you.
That's okay. I will again remind callers in neutral that you are neutral on the bill and you are not making suggestions about changes or problems that you have with the bill and the conceptual amendment as proposed today by Assemblywoman Carlton. This time, can we go to our next caller in neutral?
Caller with the last 3 digits, 341, please slowly state and spell your name for the record. You have 2 minutes and may begin.
Good afternoon. My name is Sandy Rubelid, SandyRuybalid. I represent the Department of Health and Human Services, excuse me, Division of Healthcare Financing and Policy. We are neutral on the bill and do want to reiterate that the fiscal note will be removed with the APCD provisions being removed. Thank you.
Thank you for that clarification as well. We can go to our next caller in neutral.
Caller with the last 3 digits, 582. Please slowly state and spell your name for the record. You have 2 minutes and may begin.
Good afternoon, members of the committee. My name is Jared Hildebrand, and I am the Executive Director of the Nevada State Medical Association. I apologize to Chair Carlton. I have yet to have a chance to speak with her since I just received the conceptual amendment this morning. I would just kind of like to say ditto to Mr. Clark. We would like to see an additional provider added and keep our 2 physicians currently that's on the Patient Protection Commission, and see if we could add the member that works for the FQHC's member to the commission. So I'd just like to say ditto and look forward to reaching out to Chair Carlton to discuss. Thank you.
And again, I will remind all of our seasoned lobbyists of what neutral testimony is, and I'm going to reclassify that again as opposition testimony. Do we have any other callers in neutral?
Chair, there are no more callers in neutral at this time.
Thank you. And with that, I will turn this back over to Assemblywoman Carlton for any closing remarks.
Thank you, Madam Chairman. You know, I guess neutral is in the eye of the beholder, so we'll just give them that. I understand that the conceptual amendment just came out today, so I can understand some of the confusion. I did, however, make numerous phone calls to folks to give them a heads up. So I was a bit surprised with some of the opposition that I didn't get a return call saying that they were going to be opposed, but we'll address that as we move forward. As far as the gentleman from the Medical Association, these are still doctors. They just happen to be doctors in an area with an FQHC that has patients that are impacted more by some of the healthcare issues that I believe the commission is trying to get to. So I understand everybody wants to have their seat at the table, and I'm very grateful that they all want to participate. It's sometimes very hard to get folks to show up. But I truly believe that in going through the membership of this and the evolution of this, that we are addressing the voices that the commission needs to be able to get good quality data and be able to really look at the social determinants in our healthcare system that affect Nevadans as they try to stay healthy and move forward. So I'm more than happy to have a conversation with them as we move forward. I apologize that some of them got a little twisted around the axles, but we'll keep working on it and we'll go from there. Thank you very much, Madam Chair, for having this hearing today, and appreciate all the work that your hardworking committee does. Thank you.
Thank you, Assemblywoman Carlton. And with that, we will close the bill hearing on Assembly Bill 348. This time, I will open the hearing on Assembly Bill 374. Assembly Bill 374 where it establishes requirements governing the expenditure of proceeds of litigation relating to opioids. I know that there were some pretty substantial amendments. I believe you all received that document, and it is uploaded on Nellis at this time. And welcome, Assemblywoman Toles, and begin when you are ready.
Thank you so much, Madam Chair, and thank you, members of the Health and Human Services Committee. This is a privilege. It's actually the first time that I've presented a bill before this committee, but I do appreciate how much hard work you accomplish on so many important issues. For the record, my name is Jill Toles. I represent Assembly District 25, and I'm here to present Assembly Bill 374 before this committee. I'd like to start by giving a little bit of background behind this bill and then run through the proposed amendment. As the chair just mentioned, there is a proposed conceptual amendment that is on Nellis. I also emailed you a copy last evening, and hopefully you can have that as a reference, because that conceptual amendment actually replaces the original text of the bill as introduced. And then I'll open it up for questions. I do have on this call with me some members of the Department of Health and Human Services and the Attorney General's office, along with others who will be available to help answer some technical questions that the committee might have. And so with your permission, Madam Chair, may I begin?
Yes, please feel free.
Thank you. In November of last year, the National Drug Helpline placed Nevada as one of 28 states on red alert status for increased risk of death from overdoses from opioids and other drugs. The COVID-19 pandemic has amplified the existing opioid crisis. According to the Department of Health and Human Services, Nevada has seen a 50% increase in opioid and fentanyl-related deaths, overdose deaths, since the onset of the pandemic. The National Safety Council reports that overdoses kill more of us than breast cancer, guns, and car crashes combined. Like so many in Nevada, and likely in this committee, our family too has been impacted by this crisis. When one of our family members developed a dependency on pain meds after an accident at work, that eventually turned into an addiction to other substances and tragically ended with a drug overdose just days before Christmas in December of 2007. In 2017, 626 Nevadans lost their lives, impacting countless brothers and sisters, mothers and fathers, children, spouses, and friends. But addiction is treatable, and it is a preventable disease. There are 23 million people in recovery in the United States today. Recovery is not only possible, it is probable if one receives the right type of treatment and access to support services. AB 374 seeks to establish a statewide substance use response working group under the Office of the Attorney General. I'd like to direct your attention back to that conceptual amendment and explain the reason why we replaced the original language with this conceptual amendment. As you know, the Attorney General announced just merely a week and a half ago or so that the state of Nevada received a $45 million settlement from an opioid-related case. There are many other settlements currently pending at both the state and the county level. Originally, this bill set up an advisory committee to help with the oversight and distribution. After this bill was introduced, I was made aware of another bill that is being presented by the Committee on Health and Human Services in the Senate. And after speaking with the chair of the Senate and realizing that that bill had already been a collaborative effort with the Department of Health and Human Services to administer those settlement funds and for specific programs, we reached out to other stakeholders in both the Attorney General's office as well as the Department of Health and Human Services and stakeholders in the recovery, treatment, and prevention community, and received feedback that there was actually a very strong cry for creating a sustainable working group that is statewide to help with working in collaboration to identify gaps and employing evidence-based best practices to tackle issues of substance use disorder, behavioral health, and other co-occurring disorders in our communities across every county in the state. So this document that you see before you is based on direct input from the Attorney General's office, the Department of Health and Human Services, NACO, Shatterproof, and representatives of the mental health and recovery prevention and treatment community. And I would be remiss not to say thank you, a resounding thank you to all the stakeholders for the input that went into the document that you have before you today. So I'd like to go over just a brief overview of the conceptual amendment and then answer any questions. So starting with section 1 of this amendment, the first section, the first bullet point establishes the Nevada Statewide Substance Use Response Working Group. The second section outlines the membership of the group under the Attorney General's office. The sections 3 through 6 pertain to the service requirements and other functions of the working group. Section 7 outlines the duties of the working group, and I'll just highlight a few. They include coordination of substance use prevention and reduction efforts, recommendations to be presented for a statewide plan, assessing treatment and recovery options, reviewing Nevada's existing law enforcement programs, examining qualitative and quantitative data on risk factors and rates within certain populations and geographic regions, developing strategies for implementation between local, state, and federal levels, studying the efficacy of certain programs, receiving annual reports from the Department of Health and Human Services on the use of any settlement funds money received from a judgment of civil actions, state and local funds, and any grants or gifts received. Section 7 also stipulates that the working group will submit a report to the governor, the Attorney General Advisory Commission on the Administration of Justice, and the Director of the Legislative Counsel Bureau. And then this final point in Section 8 makes this bill effective upon passage and approval. I do want to acknowledge that it is a conceptual amendment, and I do predict that our wonderful council, Legislative Counsel Bureau, will help to refine the language as we put it into the sections in the appropriate statute. Available for technical assistance on this call, I do know that the Attorney General, Aaron Ford, had hoped to join us. I'm not sure if his schedule permitted to extend his support, but I do see that we have on the call Jessica Adair, the Attorney General's Chief of Staff, Christine Brady, the Second Assistant Deputy Attorney General, Courtney Hunter from Shatterproof, which is a national nonprofit dedicated to addiction recovery based on evidence-based best practices around the nation, and Stephanie Woodard from the Department of Health and Human Services. And with that, Madam Chair, members of this committee, I would like to conclude my overview of the conceptual amendments and open it up for any questions.
Thank you for your presentation and those amendments, Assemblywoman Tolles. I have a couple of questions, and I'll give our other members an opportunity to send me a message if they have any other messages, or wave their hand, or do that little hand emoji on the Zoom, whatever is more convenient for people. You know, I'm looking at this, and I know that you had kind of based this on a former advisory commission or committee under former Governor Sandoval, and there are 16, it looks like 16 members a part of your proposed thing. How many members were a part of that prior kind of commission committee?
Thank you, Madam Chair, for the question. And I do appreciate you referencing back to a committee that was very similar in the past, that I know the stakeholders were very, very appreciative of the work that was done. And that was part of the motivation for wanting to create this sustaining ongoing working group. I will say that you will see some similarities between some of the members of that committee, but it is not a direct replication. And that's based on input in regards to really making sure that we had stakeholders that were not only at the agency level, but also really at the community level with a personal stake in these issues, including members of the recovery community and who provide services related to treatment of substance use disorders, members of the SAPTA team, as well as somebody who is in recovery and victims of substance use, or family members who were victims. We felt that it was incredibly important to make sure that we had that diverse community input into this work to really give us a hands-on view. I will let, if we do have Stephanie Woodard available to answer questions, she can give you a little bit more of the comparison between the two.
I see Dr. Woodard on there. Go ahead if you would like to unmute and answer that question as well. I'd remind you to state your name for the record before speaking.
Thank you, Chair. Stephanie Woodard for the record. What I would say is that there are some pretty big lessons learned from both having the governor's opioid accountability task force meeting, as you had mentioned before, and the makeup of that meeting, and the tasks that were undertaken with that group, along with the previous substance abuse working group under the Attorney General's office, of which I was able to participate for, I believe, the last 2 years prior to that committee sunsetting. And so what you see represented in this proposed legislation is representation that we have identified as really key in supporting the activities that this group would be tasked with. Knowing what we need for our state as it comes to collaboration and coordination, not just across grants, but across programs, really understanding the data and what the data is telling us around what some of the greatest areas of needs and gaps are in the state, and then using this group really to make informed proposals and recommendations for an overall comprehensive state plan to address prevention, substance abuse treatment, and recovery support services, and how that impacts all of the systems that substance abuse prevention and treatment and recovery touch. Is just a vitally important role for this committee to hold. In the absence of a formal convening committee over the last couple of years, it has been increasingly difficult for us to really do this type of work. And so having a formal body to convene all of the members, not only on this committee, but additional stakeholders that we had also identified as really key priority to engage in these conversations, we believe will help to take our plans for Nevada much further into the future.
Thank you, Dr. Woodard. Do we have any other questions from committee members at this time? I'm taking a look. I have everyone on the Zoom here. Seeing none, I will begin testimony in support. Do we have any members on the Zoom that want to testify in support of Assembly Bill 374? If you do, if I can get you to go ahead and unmute and begin your testimony. Seeing, oh, I do. Ms. Hunter, go ahead. Please state your name for the record. And again, limit your testimony to 2 minutes, please.
Thank you so much, Madam Chair. My name is Courtney Hunter, C-O-U-R-T-N-E-Y, Hunter, H-U-N-T-E-R, and I am from the national nonprofit group Shatterproof, which is dedicated to reversing the addiction crisis. And we want to thank Assemblywoman Tolles, the AG's office, and Dr. Stephanie Woodard for putting this thoughtful task force together. Assemblywoman Tolles stated some of the research and statistics around fentanyl overdose deaths and what's happening in the state of Nevada. And we really want to be responsive to that, as we know what works, and we need just a statewide response to help implement that. And I just want to introduce for testimony one of our Shatterproof ambassadors from the state, whose name is Kelsey Matthews, and she is the reigning Miss Las Vegas Volunteer 2021, and also the former Miss Battleborn of 2019. And she is going to speak about her personal experience and why there's such a need for this bill. So if I could pass it over to her, that would be greatly appreciated. Thank you so much.
No problem. I'll go next to Ms. Matthews. Please clearly state your name for the record and go ahead with your testimony when you're ready.
Hi there. I just want to thank the chair, the members of committee, and the bill sponsor, Assemblywoman Tolles. My name is Kelsey Elizabeth Matthews, and as Courtney stated, I am your reigning Miss Las Vegas Volunteer 2021 and the former Miss Battleborn 2019. I'm 22 years old, and I'm an ambassador for Shatterproof, a national nonprofit dedicated to reversing the addiction crisis. I'm also the founder of Treasuring Tracy, an addiction and overdose awareness platform created in memory of my mother, Tracy Matthews, who passed away of an accidental drug overdose in 2016. I have been blessed to have been able to put my platform to use here in Las Vegas community, working with organizations like Teen Challenge, the Walter Hoving Home, Foundation for Recovery, and as a licensed volunteer for Child Haven and Clark County Department of Family Services. Currently, I serve on the board of directors for Hope Compassionate Healthcare, a 501c3 nonprofit organization founded to provide comprehensive integrated healthcare and fill in the gaps found in our healthcare system. It is my life experience that has not only moved me to join the fight against the addiction and opioid crisis, but also inspired me to pursue both social work and law degrees so that I can go on to make an even greater impact in the lives of others. Addiction is a family disease. It is not just the person who is directly affected that is impacted, but the entire family unit suffers. And I can attest to that firsthand. I was parentified over my mother in her struggle with addiction as a child, and I functioned as one of her primary caretakers alongside my grandparents. This continued until her death when I was 17. I have seen things that no child should see. I have witnessed my mother overdose repeatedly, saved her life numerous times, and found myself at the hands of drug dealers, along with countless other unimaginable events, which ended with finding her dead in 2016. The reality is this: people are dying, families are broken, children are losing their parents, and parents are burying their children. This crisis is a pandemic in and of itself, and we need to start getting to the root of the problem in all forms. I was just a kid when my mother was struggling. There was so much I didn't know and understand, but now looking back, I can see that there were clear issues and gaps in the system, and those things still exist today. In the times that my mother did look for help, there was a severe lack of resources, whether it was receiving inadequate treatment from medical and mental health professionals, being stigmatized, being denied care due to insurance and financial reasons, or treatment facilities and or providers being understaffed or unprepared. This is the reality right here in our own communities. The passing of this legislation is crucial. The creation of the statewide task force being proposed is a necessary action in the fight against the crisis. In order to be successful, it's going to be a team effort. Government officials cannot do this alone. We need a diverse team of people from different backgrounds, walks of life, and parts of the state who possess real lived experiences with substance abuse. This is not a black or white issue with one easy fix or solution. Getting to the root of this problem is going to consist of many different things, including but not limited to promoting and providing adequate and specialized behavioral health treatment and counseling so that people can deal with the types of issues that often lead to addiction, like trauma, abuse, neglect, or other mental health issues. Making sure that we not only educate our medical providers properly to make sure that patients receive quality treatment and to avoid misuse of prescription medications by providers. Having resources available to assist and support family and loved ones who are directly impacted by addiction. Implementing and utilizing nonprofit organizations and private sector funding alongside government agencies to better use these resources and find better results. And overall, providing people with quality care, treatment, and resources. By creating a statewide task force on this issue,
Ms. Matthews, can I go ahead and have you wrap up your, well past your 2 minutes at this time, and I would encourage you to please, I see that you have a written statement. If you can provide that to our committee, we can also get that up on Nellis as a part of your testimony.
Sure, yeah, this is it. Thanks. By creating a statewide task force on this issue, we are giving people a chance to be a part of the solution. Before they closed the casket on my mom for the last time, I told her this: we are not done here. I made her a promise that I would not allow her death to be in vain, and that one day I would use her story, our story, to make a difference. Thank you for having me here today and allowing me to do so.
Thank you, Ms. Matthews, and I'm sorry about the loss of your mother.
Thank you.
Seeing no other support testimony on the Zoom, if we can go broadcast services to the phone line in support of Assembly Bill 374. Again, I would remind callers to clearly state and spell your name for the record and limit your testimony to 2 minutes.
Testify in support of Assembly Bill 374. Please press star 9 now to take your place in the queue. Caller with the last 3 digits, 649. Please slowly state and spell your name for the record. You have 2 minutes and may begin. Caller with the last 3 digits, 649. Please press star 6 to unmute.
Hello, my name is Sean O'Donnell for the record, SeanOdonnell. I am the Executive Director of Foundation for Recovery. We are Nevada's statewide recovery community organization, a charitable nonprofit, which is staffed, governed, and led by people in recovery from substance use disorders from local communities across our state. I'm a person in recovery from substance use disorder who has lost close loved ones to opioid overdoses. We are in support of AB 374, and I want to thank Assemblywoman Tolles for this piece of legislation. It is crucial that allocation of these funds be determined by a nonpartisan group of experts, victims, and legislators. I would, however, like to encourage the committee to consider ensuring a fair and balanced representation on the working group. This should include additional seats for the victims themselves who've been impacted by the opioid crisis. This may be people in recovery, bereaved parents, and family members. Those who've been directly impacted, lost loved ones, or their quality of life from these drugs should compose more than 2 seats. Their lived experience provides a wealth of knowledge on the solutions to help those in our community who are currently struggling. Thank you.
Thank you for your testimony and support. If we can go to our next caller on the line.
Caller with the last 3 digits, 739. Please slowly state and spell your name for the record. You have 2 minutes and may begin.
Good afternoon, Chair Nguyen and members of the committee. This is Joanna Jacob, Joanna Jacob. I'm Government Affairs Manager for Clark County. I want to go on record in support of this bill with Assemblywoman Tolles' Conceptual Amendment. I want to thank Assemblywoman Tolle and the bill proponents and everybody who came together to recreate this substance abuse response working group. And the Conceptual Amendment does allow counties to be at the table as part of the critical work that is going to be done by this group. And we believe that that is going to benefit Clark County. I really appreciate Assemblywoman Tolles and making sure that we are at the table to partner with the state and everybody involved in this important work. Thank you for your work on this, and thank you to the committee for allowing me to speak. We are in support. Thank you.
Thank you. If we can go to our next caller in support.
Caller with the last 3 digits, 863. Please slowly state and spell your name for the record. You have 2 minutes and may begin.
Hello, Madam Chair, members of the Assembly Committee on Health and Human Services. My name is Vincent Guthrow. That's spelled V like Victor, I-N-S-O-N. Last name Guthrow, G-U-T-H-R-E-A-U. I serve as the Deputy Director of the Nevada Association of Counties, or NACO. NACO supports AB 374 with the presented amendment, and we wanted to thank the sponsor for including counties in this conversation and as members of the response group. All counties in Nevada have felt the impacts from the opioid epidemic in their communities and also on the services they provide to support the most vulnerable. So thank you, Madam Chair. Just wanted to put that on the record, and thank you for the opportunity to testify in support of AB 374. Thank you.
Thank you. If we can go to our next caller in support.
Chair, there are no more callers in support at this time.
Thank you. And I noticed that I missed a hand up, I think I saw a hand up earlier on the Zoom from Miss Christine Brady. I don't know if she wanted to testify in support. I'm going to go to her right now and see.
Yes, please, Madam Chair.
Go ahead when you're ready. If you could state your name and again, limit your testimony to 2 minutes. Thank you, Miss Brady.
Christine Jones Brady, for the record, Second Assistant Attorney General for Nevada. I just want to thank Assemblywoman Tolles for how she was reaching out to us and all the stakeholders. Just to let you know, one of the areas I work with over at the Attorney General's office is the Bureau of Consumer Protection, as well as our investigative staff, our Medicaid fraud control unit, and our criminal prosecution unit. And in that work, in the community, I have had many requests over the last 2 years that I've been here to have such a committee as this. And it's very important. And just to say that this committee is they're like railroad builders. They're building a railroad track across our entire state. And they're going to be well positioned with the people that they have on it, as well as the people that they will be consulting in order to put together a plan and analyze the plan and give recommendations on a plan to combat substance use in our state. They will be able to bring together areas across the state, the rural areas that currently don't have access, urban areas, and other underserved communities, African American populations that have been hard hit by this, as well as Hispanic and LGBTQ and other communities. So this is an important committee that will be working hand in hand with Health and Human Services to combat a very aggressive problem that we have in our state, and the Attorney General's office is proud to support it. Thank you.
Thank you, Ms. Brady. At this time, I will go to the phone lines now for testimony in opposition of Assembly Bill 374.
Testify in opposition to Assembly Bill 374, please press star 9 now to take your place in the queue. Chair, there are no callers in opposition at this time.
Thank you. Do we have any callers in neutral on Assembly Bill 374?
To testify in neutral to Assembly Bill 374, please press star 9 now to take your place in the queue. Chair, there are no callers in neutral at this time.
Thank you. And at this time, I will turn it back over to Assemblywoman Tolles for any closing remarks.
Thank you so much, Madam Chair and members of this committee. I'm just having a moment. This means a lot to so many of us personally who've been impacted by this, and I'm truly grateful. And thank you for having this hearing today. Thank you for your interest in these issues and trying to find statewide collaborative solutions that truly do impact people's lives and families. The last comment that I would just like to make is that a few members have reached out to ask to join on as co-sponsors, including the chair of this committee. I appreciate that, as well as the chair of the Senate Health and Human Services, Senator Julia Ratty. And I apologize that I wasn't able to get more signatures before submitting. It was up against the deadline, but I would be honored to have any of you join on as co-sponsors for this legislation. If you would like to, please just contact my office or email me directly. And thank you so much, and I would urge your support.
Thank you for that, Assemblywoman Tolles. And with that, I will close the bill hearing on Assembly Bill 374. At this time, we will begin public comment. Broadcast services, can we go to the line and see if there are any people waiting in the queue for public comment? Again, I'd remind public commenters to please clearly state and spell your name for the record and limit your comments to 2 minutes.
If you would like to participate in public comment, please press star 9 now to take your place in the queue. Chair, the public line is open and working, but we have no callers for public comment at this time.
Thank you, and thank you to everyone. We're getting out of here a little bit early, so hopefully with this crazy, hectic last 2 weeks, this will give you a little bit of breathing time before we go back to floor. With that, I will see if there are any comments from committee members. Seeing none, at this time, I will adjourn the meeting until Wednesday, April 7th. Have a nice afternoon, everyone.
Thank you, Chair.